my name's Victoria. I'm going to be your nurse today.
Hi, Victoria.
Can you verify your name for me?
Debbie Pellion,
And your date of birth?
7/18/65.
And what's today's date?
Today is November 13th.
And where are you at right now? Do you know?
Doctor's office.
Terrific. Why are you here today?
Physical.
Awesome. Just wash my hands here. Are you feeling any chest pain right now?
No.
Do you have any family history of heart disease, high blood pressure, anything like that? Any
No.
kind of cardiac events?
No.
Or yourself?
No.
Are you on any medications?
No.
Okay, I'm going to take your blood pressure.
Okay.
All right, left side is better. Okay, you can just relax your arm right here. What's your normal blood pressure? Do you know it?
Usually runs around 110/60.
All right, thank you. Terrific. It's 115/60. Very good.
Right.
That is normal range. Do you have any certain risk factors for heart disease? Like, do you have any smoking history?
Yes, I used to smoke.
How much did you smoke?
A little less than a pack a day.
How long did you smoke for?
Around 40 years.
How long has it been since you quit?
4 years.
Awesome. Good job.
Thank you.
Do you have a high fat, high cholesterol diet?
No.
Do you eat a lot of vegetables?
I tried.
All right. Do you experience pain in your legs ever?
No.
And do you ever notice swelling in your ankles or feet?
No.
All right, I'm going to do the full cardiac assessment now. I'm going to look at you. If you sit straight up for me. Looking at your symmetry of your thorax, both sides as you breathe. Front and back. I'm going to feel the temperature of your skin. It's warm, dry. And I'm going to look at your skin. You're naked right now, and you have no scarring anywhere.
No.
I'm telling you, you have none.
I know I have none.
All right, you can, if you could lay back here for me,
Okay.
it'll put you at a 45-degree angle, and I can finish the assessment. All right, I'm checking for any central cyanosis, no blue tint to the lips, mouth, or conjunctiva. All right, I'm looking at the PMI, which is the point of maximal intensity. And if I couldn't see it, I'd ask her to lay on her left side. And with clothing, I can't see it anyway. Let me look at your eyes. I'm looking for any gray rings around your iris, because that would be indicative of possibly high cholesterol. And yellow plaque, like around your eyes on the skin, and I can check your elbows for that too. That would also be indicative of high cholesterol. And I'm gonna pull your eyelids down to check you for anemia. All right, they look good too. Negative for anemia. All right, I want you to put your fingernails, your index fingernails, together like this, like you're doing a heart.
Yeah.
And I don't see any space. That's indicative of clubbing. That could be because you chew your fingernails really bad.
Really bad, yeah.
How long have you been doing that?
53 years. As long as I've been alive.
All right. Well, clubbing could be a sign of chronic heart disease or chronic respiratory disease.
Okay.
You haven't been diagnosed with either of them, correct?
No.
All right. Okay, I'm going to put my hands on your chest and feel around for different pulses, okay?
Okay.
I'm putting my left hand on the aortic and nope. All right, Debbie. I'm going to check your neck. If you could turn your head to the left, I'm going to be looking at your jugular vein. I see a pulsation in waves. It is not distended. And now I'm going to palpate your chest to feel around for different heartbeats.
Okay.
All right. Let me know if it hurts.
Okay.
All right. Left hand I'm putting on your aortic pulse, and that's the second intercostal space on the sternal border. And then my right hand I'm putting on your pulmonic pulse to the left of your sternal border. And then I'm going to check down for the Erb's point, which is the third intercostal space, still at the sternal border. And I'm going to feel for the tricuspid valve pulse, and that's at the fourth intercostal space. And then for the mitral valve, I have to go to the mid-clavicular area and the fifth intercostal space. Excellent. I'm going to check your pulses now. I'm going to check your temporal first. They are both equal in rate and rhythm. And I will be palpating your carotid pulse, but first I need to listen to it to make sure there is no bruit, because if there is, there could be plaque there, and if I palpate it, I could knock it loose. So I'm going to listen first. Negative for bruit. Now I can palpate. Okay, that's good. Now I'm going to feel the right side. I have to do each side separately so I don't make you pass out. Both sides are equal in rhythm and rate, and I would grade it at a +2 to 3. I'm going to go ahead and count your pulse at this location for a full minute. '62, perfect. I'm going to check your radial pulses at your wrist. They're both equal in rate and rhythm. And I'll check your brachial pulses as well. It's up here, your inner arms. Actually, up here was a little easier. That on like that, thank you. And they are both equal in rate and rhythm as well. Before I listen to your heartbeats, I'm going to check your PMI, which is your point of maximal intensity,
Okay.
which is in that 5th intercostal space again. And it's not always real clear to feel in this position. If you could turn on your left side for me, that puts your apex right near your chest wall where it's easier to feel. Terrific. And that's negative for enlarged heart.
Very good.
Turn back around. And now I'm going to take a listen to you. I'm going to listen to 5 different sites, and I'm going to listen on both sides with my stethoscope.
Okay.
I'm going to go to the 2nd intercostal space on the right side of the sternal border to listen to your aortic valve. And then I'm going to do on the other side, 2nd intercostal space to the left of your sternal border for your pulmonic valve. And I'm going to move down to the 3rd intercostal space on the left sternal border for the Erb's point. And that's the point where you can hear the valves closing, both the aortic and pulmonic. That's where you can hear it best. And I'm going to move down to the 4th intercostal space so I can listen to your tricuspid valve. And again, I'm going to reach up to the 5th intercostal space, mid-clavicular line, so I can listen to your mitral valve. Excellent. I didn't hear any bruit or thrill anywhere. No murmurs. That's good news.
Yes, that is good news.
And do you have, I'm sorry, I must listen on the other side of my stethoscope. and I'm against skin contact. And it's pulmonic, Erb's point, tricuspid valve, and mitral valve. All right, thank you so much. I did not hear any murmurs.
Good.
Do you have any questions?
No, I don't think I do.
All right, I will let the doctor know that you're ready for him to see you.
Okay.
And it was really nice meeting you,
You
Debbie.
too. Thank you very much.
You're welcome.